Hi guys, welcome back to my channel. My name is Elizabeth. I make mom and lifestyle videos, so if you enjoy that kind of content, make sure you give this video a thumbs up and subscribe. And if you're already a subscriber, thank you so much for your support. I'm mom to a toddler Dominic and a 9-day-old baby girl. So if you couldn't already tell, I'm clearly not pregnant anymore. I had our little girl on February 13th, and we are currently 9 days postpartum. When I was 40 weeks pregnant, I wasn't really in a good place physically or emotionally to film a video, but I did want to talk about my 40-week pregnancy update. She was actually born at 40 weeks plus 5 days, so it'll actually be about a week and a half of pregnancy updates. I'll be making another video more about how our baby's doing and a name reveal, and I also want to dedicate a video for her birth story. So first, my weight gain. I ended the pregnancy at about 159, started about 127, so I gained about 32 pounds altogether, and I'm already down to about 150, so I lost about 9 pounds just from basically having the baby. So since we have a toddler and planned a hospital birth, the plan was for my mom to watch and take care of our toddler while we were at the hospital. She had been kind of on call for a couple weeks for whenever I went into labor, but she lives about 45 minutes away. So actually on my due date, we decided for her to come up and just stay with us until the baby was born. So that way she wouldn't have to worry about coming up here in the middle of the night, since we figured it would probably be the middle of the night. That's how it was with my first baby. And also, since I was so pregnant, I kind of needed a little bit of help with Dominic anyway, so that worked out perfect. As far as my symptoms, my last 12 days of pregnancy, I was definitely starting to have some kind of insomnia, not particularly that I couldn't fall asleep, but rather I kept waking up, and I was waking up thinking that I was in labor, because with Dominic, I woke up at 4 o'clock in the middle of the night to contractions, so I kept thinking that that was going to happen again, and I had a lot of Braxton Hicks contractions. I would have probably 20 to 30 throughout the day, and then I would have a few more at night. And then the last few days, they started to get a little bit crampy. That's how labor started with Dominic. So I really thought that I was going into labor for like the 4 days before she was actually born. Kept waking up thinking that it was gonna happen. But it didn't until 5 days after my due date. Now Dominic was born at 40 plus 2, so I really thought that she would be born by then, or even a few days earlier. For me, the last few weeks of pregnancy get pretty hard. It's physical, just I can't really bend down, I can't go faster than a slow walk, so it's really hard to keep up with Dominic, make sure he doesn't get himself in trouble. The Braxton Hicks contractions were getting to be a lot, and of course I really wanted to meet my baby, so it was a little bit of a hard time physically and emotionally for me. I had a prenatal appointment at 40 weeks plus 3 days, so that was a Thursday. My midwife said I was around 2 to 3 centimeters dilated, 60% effaced, and I asked her to go ahead and do a membrane sweep. And with Dominic, I had a membrane sweep, and I went into labor the night/morning after that. So I thought for sure I would go into labor after that. I decided with this pregnancy, I didn't want to go past 41 weeks. There are a couple reasons. Partially, like I said, I was just so physically and emotionally done with being pregnant. It was getting really hard on me. It was getting hard on my husband since we had been quarantining for several weeks. And also there have been some studies showing a slightly higher risk of having a stillborn baby after 41 weeks because the placenta can start to deteriorate and it's less efficient at getting nutrients to your baby. And the babies in the studies generally did a bit better if they were induced at 41 weeks rather than going all the way to 42. So I decided for me personally, I would schedule an induction if we got to 41 weeks. And also, since my body had started to dilate, I talked to my midwife about it, and we figured if I did need to get induced, it probably wouldn't take very much for me to get labor going. When you get induced, you get a Bishop score, which is basically kind of how ready your body is for labor already and how much of an induction you might need. I had a Bishop score of 6. It's like how dilated you are, how effaced you are, what position the baby is in. Ideally, you want at least an 8 or a 10 to get induced, but she said I would probably be several points higher if we made it to Monday. She likes to growl. At the end of my prenatal appointment, it's actually a little bit funny of a story because I went to schedule the induction for Monday morning. The midwife recommended a morning slot because since it probably wouldn't take much to get me into labor, she said that way I would be able to have had a full night's rest the night before and come in and have the baby sometime during the day. If somebody is probably going to need a bit more to go into labor, she would recommend a nighttime slot, so that way they can start the induction and let the person just rest in the hospital while the labor is still in the early stages. we tried to get a Monday slot, and Monday actually ended up being completely full already. So we looked at Tuesday. Tuesday was already full. There was a slot on Wednesday, but that would have been 41 plus 2. And I know at my midwife and doctor's office, they like to do a non-stress test and an ultrasound to check your fluid levels at 41 weeks to make sure your baby's doing okay. So I would have either had to have scheduled that or gone an extra couple days without it. I didn't really feel comfortable doing that. So we looked at Sunday. Sunday didn't have any morning slots available. But it did have a night slot. So we said, okay, we'll just go for the Sunday night slot and take naps if we need to. So we scheduled that. And then I went ahead and scheduled my 6-week postpartum visit. Right as soon as we finished scheduling that appointment, the receptionist got a call back that somebody who had an induction scheduled for Monday at 9 was actually having her baby, so we could take that slot. So we did that. Turns out we didn't end up needing an induction anyway, because like the midwife said, I probably wouldn't go to Monday. Sure enough, I didn't. At that appointment, when the midwife was testing my baby's heart rate, she noticed it was a little bit low just for a few seconds, but she wanted me to have a non-stress test before we left, which is where they tie a heart rate monitor onto your belly, one for baby, one for you, and they monitor you. Mine was 20 minutes just to make sure that the baby's heart rate is okay. If the heart rate isn't okay, then they would probably send you in immediately for an induction. I did that at the end of my appointment for the 20 minutes, and her heart rate was fine, so luckily we didn't have to worry about that. She was moving a ton during that non-stress test. I got some of it on video here. That is about everything for my 40-week / 40 plus 5-week pregnancy update. I don't have a bump shot for the video, but I did take a couple pictures 2 days before she was born, so I'll show you guys those bump shots. I'll also show you what I'm looking like 9 days postpartum if she'll behave. So I still look a little bit pregnant, but not too bad. The stretch marks are already going down. I have a little bit of red kind of up to the top, but they've already started to fade a bit. And from the side, a lot of this is just really squishy and loose skin. Of course, I'm not gonna have a flat stomach right after having a baby, but it's of course a lot smaller than it was a couple weeks ago. Thank you so much for watching. Don't forget to give this video a thumbs up and subscribe.